Welcome in, everyone, to another deep dive with us.
Always exciting to get to dive into these fascinating topics.
And we're diving into a big one today, folks, the Bordetella genus.
A group of bacteria that I'm sure many of our listeners out there, especially those medical microbiologists, are very familiar with.
And to guide us through this deep dive, we're going to be looking at the Principles and Practice of Clinical Bacteriology text.
Which is a really great resource, covers a lot of really in-depth information on all sorts of clinically relevant bacteria.
We really want to kind of go beyond the basics here, explore the nuances of the different Bordetella species, their virulence factors, and how all that really plays into their ability to cause disease.
And ultimately how we can use that information as medical microbiologists to accurately diagnose and treat infections.
Yeah, absolutely. So to kick things off, the book describes 7 different Bordetella species, each with its own kind of unique characteristics.
Right, and all of that is summarized really nicely in Table 18.1, which I would definitely recommend checking out if you haven't already.
Yeah, Table 18.1. That's going to be our roadmap for today for sure.
Yeah, and what I think is really interesting is how, even though these species are closely related, they have this wide range of characteristics. You know, some grow on certain media, others don't. Some are motile, some aren't.
And even down to their DNA.
Exactly, their G+C content, which refers to the percentage of guanine and cytosine bases in their DNA. That varies between these different species.
So it's not just what we see under the microscope. It goes down to the molecular level.
Absolutely, and all of this variation reflects their different evolutionary journeys and helps us classify them.
Speaking of classification, there's one Bordetella species that seems to have a preference for birds, Bordetella avium.
Ah, yes. B. avium. Definitely a significant pathogen for our feathered friends. But interestingly enough, it hasn't actually been found in humans.
So that leaves us with 6 other Bordetella species to worry about.
That's right. 6 species that are particularly relevant to the work of medical microbiologists.
All right, so let's focus then on those big 3 that cause most human infections. Bordetella pertussis, Bordetella parapertussis, and Bordetella bronchiseptica.
The usual suspects. Then I think it's interesting to start with B. pertussis and B. parapertussis, because they can actually cause very similar symptoms, coughing, vomiting, things like that.
But I think we both know pertussis tends to be the more severe one, often leading to that classic whooping cough.
Yeah, and there's a good reason for that. B. pertussis produces this really potent toxin called pertussis toxin, which B. parapertussis lacks.
Oh, right. I remember learning about that toxin back in school, but I'd love to kind of refresh my memory. How does that toxin actually contribute to those more severe symptoms?
So pertussis toxin, it really messes with the cellular signaling pathways in the respiratory tract, and that leads to this whole cascade of effects, inflammation, increased mucus production, and that's what ultimately causes those severe coughing spells we see in whooping cough.
So it's not just about the bacteria themselves, it's about the tools they bring to the party.
Exactly. It's those virulence factors that really determine the severity of the infection.
And if you want to see a nice summary of those virulence factors for different Bordetella species, definitely check out Table 18.2 in the book.
Table 18.2, a must-read for any aspiring Bordetella expert.
And speaking of which, I came across something interesting in the book. They mentioned a genetically distinct strain of B. parapertussis found in sheep.
Ah, yes, that's a fascinating point. It highlights that we can't just focus on humans. We need to consider animal reservoirs as well.
It's all connected.
It really is.
All right, so we've talked about pertussis and parapertussis. Now let's move on to our third player, Bordetella bronchiseptica.
Now this one is a bit different. Unlike B. pertussis, which seems pretty happy infecting humans, B. bronchiseptica has a much wider host range.
Yeah, I remember reading that it can infect cats, dogs, even pigs.
It's a true multi-species pathogen, which makes it a bit trickier to track from an epidemiological standpoint.
And while it shares some of those virulence factors, with pertussis,
You can see that in Table 18.2.
infections in humans tend to be less severe.
Generally speaking, that's true. But we do have to be careful, because in immunocompromised individuals, B. bronchiseptica can actually cause some pretty serious infections.
So it's not always a walk in the park.
Definitely not. And it highlights the importance of considering the host's immune status when we're assessing the potential severity of any Bordetella infection.
All right, so we got these 3 major players, each with its own set of tricks. But let's dive a little deeper into those virulence factors. The book really paints a fascinating picture of the arsenal that B. pertussis uses to wreak havoc in the respiratory tract.
It's quite the arsenal. They've got adhesins to help them stick to cells, toxins to disrupt cellular processes. It's a whole coordinated attack.
It's like they've got a whole toolkit specifically designed for invasion and destruction.
And one of the most interesting tools in that toolkit is the BVGAS locus.
The BVGIS locus, what is that exactly?
So it's essentially a genetic control switch that regulates the expression of many of those virulence factors. It's like a bacterial dimmer switch, turning the virulence up or down, depending on environmental cues.
That's the great analogy. So they can kind of tailor their attack based on where they are and what they're up against.
Exactly. They're very adaptable.
And the book highlights some of the key players in this whole virulence orchestra. We've got filamentous, hemagglutinin, Fimbriae, Pertussis.
Those are the sticky molecules that help Bordetella adhere to those respiratory cells.
Like little grappling hooks. And then, of course, we can't forget about the infamous pertussis toxin, the one that really causes those severe whooping cough symptoms.
Right, and what's fascinating is that both B. parapertussis and B. bronchiseptica actually have the genetic blueprint for pertussis toxin.
They do?
They do, but they can't actually produce it.
Why not?
Because of mutations in their genes.
It's like they have the recipe, but they can't quite follow the instructions.
Exactly. Sometimes those genetic quirks can make a big difference.
So we've got these different species, each with their own unique set of virulence factors. But how do we actually go about diagnosing pertussis in the lab?
That's a great question, and it can actually be pretty tricky, especially with vaccinated individuals, often presenting with milder symptoms.
Right, because we don't always hear that classic whoop anymore.
Exactly.
Yeah.
So clinical diagnosis alone can be unreliable.
So what are our options then? What tools do we have at our disposal?
Well, culture is often considered the gold standard. It allows us to isolate and definitively identify the bacteria.
But I imagine it has its limitations.
It does. It can be time-consuming.
Yeah.
And it might not always give us a positive result.
Especially if the patient has already started antibiotics.
Right, or if the specimen wasn't collected properly.
So what about PCR? That seems like a faster and more sensitive option.
It is. PCR is definitely a valuable tool. It's quick, it's sensitive, and it targets specific genetic sequences of Bordetella.
But there's always a but, isn't there?
There is. And in this case, the but is that the IS481 target, which is commonly used for pertussis, can also pick up Bordetella homesi.
Bordetella homesi.
Yeah, it's a species that's not typically associated with whooping cough.
So we could get a false positive.
Exactly.
So PCR isn't a perfect solution either.
No test is perfect, unfortunately.
All right, so we've got culture, we've got PCR. Are there any other diagnostic methods we should consider?
Well, serology can be helpful. That's where we look for antibodies against Bordetella.
Right, so we're looking at the immune response.
Exactly. And it can be useful for confirming past infection, especially in adults.
But I imagine it's not as helpful for diagnosing those acute cases.
Right, because those antibody levels take time to rise.
So it seems like we're building a case here for a multifaceted approach to pertussis diagnosis.
I think that's a good way to put it. We need to be strategic. Consider the clinical context, the limitations of each test, and the resources we have available.
Sometimes it takes a combination of methods to get that confident diagnosis.
Absolutely. And of course, clinical judgment is always key.
Okay, so we've talked about the different Bordetella species, their virulence factors, and the challenges of diagnosis. But there's a lot more to cover. So make sure to join us for the next part of our deep dive into the world of Bordetella.
We'll be exploring what happens when these bacteria actually invade their human hosts, talking about the clinical features of infection and how to manage these tricky cases.
So stay tuned.
Welcome back, everyone, to our deep dive into Bordetella.
Glad to be back.
Now we've talked about the different species and their virulence factors, but let's shift gears a bit and talk about what happens when these bacteria actually invade their human hosts.
Right. We've been focusing on the bacteria themselves, but ultimately, we're concerned with how they affect people.
Exactly. So for this part, let's zero in on Bordetella pertussis, the classic culprit behind whooping cough.
I think every medical microbiologist out there has encountered pertussis at some point in their career.
It's a pretty memorable bug, especially when you hear that characteristic cough.
So let's talk about the clinical presentation of pertussis. What does it actually look like in patients?
Well, the clinical course is often described in 3 stages: the catarrhal stage, the paroxysmal stage, and the convalescent stage.
Ah, yes, the classic 3 stages of whooping cough.
It's a good framework, but I think it's important to remember that not all patients follow this exact pattern.
Especially those who have been vaccinated.
Exactly. Vaccination can definitely modify the disease course.
So let's break down these stages then, keeping in mind that there can be variations.
Okay, so the first stage, the catarrhal stage. This one typically lasts 1 to 2 weeks, and it often looks a lot like a common cold.
So runny nose, sneezing, low-grade fever.
Pretty non-specific symptoms.
Easy to miss the diagnosis at this point.
Very easy. And that's actually part of the problem, because people might not realize they have pertussis, and they can easily spread it to others.
It's sneaky like that.
It is.
Ugh.
But then comes the paroxysmal stage. This is where things get interesting, or should I say, loud.
This is where we hear that classic whoop.
Exactly. The cough becomes much more intense. It comes in these repetitive bursts called paroxysms, followed by a struggling inhalation, which produces that whoa sound.
And it's not just a sound. It represents a real struggle for the patient to breathe.
Absolutely. Those coughing fits can be incredibly distressing, especially for infants and young children.
And the book mentions some other complications that can arise during this stage. Things like pneumonia, seizures, even encephalopathy.
It's a reminder that pertussis is not a benign disease. It can have serious consequences.
Especially in those vulnerable populations.
Exact.
So we've got the catarrhal stage, the paroxysmal stage, and finally the convalescent stage. What happens here?
So in this stage, the cough gradually subsides. The patient starts to recover.
But recovery can be slow.
They can be. That cough can linger for weeks or even months.
So it's not just a quick in and out kind of infection.
Definitely not. And it highlights the need for supportive care and patient education.
Right, making sure patients understand that they might still be contagious even as they're recovering.
That's crucial for preventing further spread.
So we've talked about the clinical presentation, but let's circle back to diagnosis for a moment. We touched on it earlier. But the book really emphasizes that confirming pertussis can be tricky.
It can be, especially in those vaccinated individuals who often have those milder, atypical presentations.
So we can't just rely on clinical symptoms alone.
Nope. We need laboratory confirmation.
And we talk about some of the options. Culture, PCR serology.
Each with their own strengths and weaknesses.
Let's revisit those a bit, starting with culture, the so-called gold standard.
It's the classic method, but it does have its limitations.
Like what?
Well, it requires specialized media, and it takes time to get those results.
Often several days.
Right. And even then, we might not get a positive result.
Especially if the patient has already started antibiotics.
Or if the specimen wasn't collected properly.
So while culture is valuable, it's not always the most practical option.
Especially when time is of the essence.
What about PCR then?
PCR is a great tool. It's fast, it's sensitive, but as we mentioned earlier, it's not without its quirks.
Right, that IS-481 target can sometimes pick up B. homozygote, leading to those false positives.
Exactly. We always have to be aware of those potential pitfalls.
So what about that direct fluorescent antibody test, the DFA? The book mentions that as an option.
Yeah, DFA can be helpful. It's a rapid test that uses fluorescent antibodies to detect Bordetella directly in respiratory specimens.
So it's faster than culture?
It is, but its sensitivity and specificity can vary.
Depending on the quality of the specimen.
And the experience of the person interpreting the results.
So it's another tool in our toolbox, but not a perfect one.
Right.
And then there's serology, looking for those antibodies against Bordetella.
Serology can be helpful, especially for confirming past infection.
But not so much for those acute cases.
Right, because those antibody levels take time to develop.
So it seems like we're back to that multifaceted approach.
Exactly. We need to use all the tools at our disposal and carefully interpret the results in the context of the clinical presentation.
It's like putting together a puzzle.
It really is.
Okay, so let's say we've navigated the diagnostic maze and we've confirmed a case of pertussis. Now what? How do we actually treat this infection?
Well, the good news is we have effective antibiotics for pertussis.
That's always good to hear.
And erythromycin has been the go-to for decades.
Erythromycin, a macrolide antibiotic.
That's right.
And the book recommends it as the first-line therapy.
With a typical course lasting 14 days.
But are there ever situations where a shorter course might be sufficient?
That's a good question. For vaccinated children who tend to have milder illness, a shorter course of 7 days might be enough.
But it's always a case-by-case decision.
Absolutely. We have to consider the individual patient
Yeah.
and the severity of their illness.
And of course, we always emphasize completing the full course of antibiotics.
Even if the patient starts feeling better sooner.
Right. We don't want to give those bacteria any chance to develop resistance.
Exactly.
And the book also mentions some other macrolides, like clarithromycin and azithromycin,
Yeah.
as potential alternatives.
Right, for patients who can't tolerate erythromycin. Those can be good options.
But more research is always needed.
Absolutely. We're always looking for better treatment strategies.
Okay, so we've got our treatment plan in place. But what about managing the infection and preventing further spread?
Right, so that's where infection control measures come in.
Things like isolation.
Exactly. Especially during those early stages when the patient is most contagious.
And good old-fashioned hand hygiene.
Can't forget about hand hygiene.
And then there's chemoprophylaxis.
Giving antibiotics to close contacts to prevent them from getting sick.
Right? The book highlights the importance of that, especially for those vulnerable contacts.
Like infants and immunocompromised individuals.
But I imagine it can be logistically challenging.
It can be. You have to identify all the contacts, make sure they get the antibiotics, make sure they take them properly.
It's a whole process.
It is, but it's an important one.
So it's a multi-pronged approach. We've got individual level interventions, like treatment and isolation, and then those population level strategies, like vaccination.
And public health messaging.
Reminding people to wash their hands, cover their coughs, all the important stuff.
It all adds up.
And that brings us back to prevention. We've touched on vaccines a bit, but I think it's worth diving a little deeper.
Definitely, because vaccines are really our best weapon against pertussis.
So let's talk about the different types of pertussis vaccines.
Okay, so we've got two main types, whole cell vaccines and cellular vaccines.
Whole cell vaccines, those are the ones that contain inactivated whole B pertussis cells.
That's right, they've been around for a long time. And they've been very effective.
But they can also cause more side effects.
Yeah, they're a bit more reactogenic,
Yeah.
especially in terms of fever and local reactions.
So that's why cellular vaccines were developed.
Right, they contain purified components of the bacteria rather than the whole cell.
And they tend to cause fewer side effects.
They do, but there's still some debate about their long-term effectiveness compared to whole cell vaccines.
Right, and the book also mentions that the optimal composition of those cellular vaccines is still being investigated.
Exactly. There are different combinations of antigens, and we're still trying to figure out which ones work best.
So it's an evolving field.
It is.
And then there's the issue of waning immunity.
Ah, yes, waning immunity, the bane of our existence.
It affects both whole cell and cellular vaccines.
Right. That's why we need those booster doses to maintain protection.
Especially as we get older.
Exactly.
So it's not just about getting vaccinated once, it's about staying up to date with those booster doses.
And the timing of those boosters is still a topic of discussion.
There's no one-size-fits-all approach.
Right. We have to consider age, previous vaccination history, all sorts of factors.
So it's a complex issue.
It is. But vaccines are still our best bet for preventing pertussis.
And we have to keep advocating for them.
This-
All right, so we've covered a lot of ground here. From the clinical presentation of pertussis to the challenges of diagnosis and treatment and the importance of prevention.
It's been a whirlwind tour.
But there's still more to explore. So make sure to join us for the final part of our deep dive into the world of Bordetella.
We'll be talking about the epidemiology of pertussis, the global burden of disease, and the ongoing research efforts to develop new and improved prevention strategies.
And we're back for the final leg of our Bordetella deep dive.
Ready to wrap things up.
I am. We've covered a lot of ground. From the bacteria's sneaky tactics to those diagnostic challenges.
And treatment options, of course.
But now, I think it's time to step back a bit. Look at the bigger picture.
The broader implications of all this.
Right, because as medical microbiologists, we're not just working in a vacuum.
Our work has real-world consequences.
We play a crucial role in protecting public health.
Absolutely.
And understanding Bordetella is a big part of that.
It is. So let's revisit some of those epidemiological points, highlighted in the Principles and Practice of Clinical Bacteriology text.
Sounds good.
Now, as you know, pertussis is an endemic disease.
Meaning it's constantly circulating in the population.
Right. It never really goes away.
And that's where we see those cyclical outbreaks.
Exactly. And those outbreaks are influenced by a whole bunch of factors.
Like waning immunity,
Right.
changes in vaccination practices.
And even the evolution of those Bordetella strains themselves.
It's a complex interplay.
It really is. And the book actually mentions that pertussis has been resurging, even in countries with high vaccination coverage.
Which is a bit concerning.
It is. It highlights the challenges we face in trying to control this disease.
It's a reminder that vaccination, while incredibly important, isn't a one-and-done solution.
Exactly. We need ongoing surveillance, booster doses, and potentially even new vaccine strategies.
To keep those immunity levels up.
And to protect those most vulnerable.
Speaking of vulnerable populations, we can't forget about infants.
Right, those little ones who are too young to be fully vaccinated.
They're at the highest risk.
For sure.
And that's where strategies like cocooning come into play.
Yes, cocooning, creating that protective circle around those vulnerable infants.
Vaccinating all their close contacts.
It's a crucial strategy, especially in those early months, before infants can complete their own vaccination series.
But even with cocooning, we still need to be vigilant.
Absolutely. We need to identify and manage cases quickly to prevent further spread.
And the book mentions contact tracing as a key part of that.
Contact tracing is essential. It's all about identifying those individuals who've been exposed to someone with pertussis.
And then providing them with prophylaxis or treatment.
To prevent them from getting sick and spreading the bacteria further.
It sounds like a lot of work.
It can be, but it's crucial for breaking those chains of transmission.
It takes a team effort.
It does. Healthcare providers, labs, public health authorities, we all have to work together.
Okay, so we've talked about the big picture, the public health perspective. But let's zoom back in to the lab for a moment.
Back to our comfort zone.
Right, because the book also provides some really interesting insights into the genetic diversity of Bordetella.
Ah, yes, Bordetella genetics. Always a fascinating topic.
It is. And the book specifically mentions these things called insertion sequence elements, or IS elements.
Oh, yes, elements. They're like little jumping genes that can move around within the genome.
So they're not just sitting still?
Nope, they're dynamic.
And why are they important?
Well, they can act like genetic fingerprints, helping us differentiate between different strains of Bordetella.
So we can track outbreaks.
Exactly. We can see how these strains are related, where they've come from.
And we can even learn how these bacteria are adapting to things like vaccine use.
Right. We can see how they're evolving in response to those selective pressures.
It's like having a window into their evolutionary history.
It is. And the book talks about a couple of specific IS elements, IS-481 and IS-1002, which are commonly found in Bordetella.
And by analyzing those elements, we can actually differentiate between B. pertussis, B. parapertussis, and B. bronchiseptica.
Which can be really helpful for those epidemiological investigations.
So it's not just about identifying the species, it's about understanding the strains within those species.
Exactly.
And all of this genetic information can help us tailor our prevention strategies.
Right. If we see certain strains becoming more prevalent or developing resistance to antibiotics, we can adjust our vaccination protocols or our treatment guidelines.
It's a constantly evolving field.
It is, and we have to stay on top of it.
Speaking of evolving, the book also highlights several areas where further research is needed.
There's always more to learn.
Always. Like determining the long-term efficacy of those cellular vaccines, identifying the best booster strategies
for different age groups,
and developing new vaccines that provide broader and more durable protection.
That's the holy grail.
It is. And we can't forget about antibiotic resistance.
Of course, we have to keep monitoring that, make sure we're staying ahead of the curve.
It's an ongoing battle.
It is. But it's one we're committed to fighting.
Absolutely.
Well, I think we've covered just about everything.
I think so, too.
From the microbiology of Bordetella to the clinical features of pertussis, the challenges of diagnosis and treatment, and the importance of prevention and control.
It's been a pretty comprehensive deep dive.
It has.
And I hope our listeners out there have found it informative and maybe even a little bit inspiring.
Because at the end of the day, that's what it's all about. Using our knowledge to make a difference, to protect people's health.
To improve lives.
Exactly.
So thank you for joining us on this journey into the world of Bordetella.
Keep learning, keep asking questions, and most importantly, keep those petri dishes clean.
Until next time.